Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about artificial rupture of membranes, AROM, capital A-R-O-M. This is a procedure that we do often during labor, whether if you're being induced or whether you're going into labor spontaneously, unless you rupture your membranes by yourself, and that's called SROM, spontaneous rupture of membranes. So the amniotic sac is the bag of water, that's the sac, and this is surrounding the baby, and the amniotic fluid is the fluid that the baby's floating in, which, by the way, is mostly baby pee, baby urine. That's what that fluid is. It's also what's called a transudate, or fluids that comes from the placenta, and that fluid is what comes out when we break a bag of water. So once your cervix is dilated enough, we might do it at 1 centimeter, 2, 3 centimeters dilated, then if you're in labor, it can help you progress a little faster, or it can actually be used to initiate an induction. Sometimes if you have what's called a favorable cervix ready, just breaking the bag of water is enough to get things going. It helps to assess the well-being of the baby, because when we break the bag of water, we can see, is the fluid clear or is it meconium stained? Meconium is when the baby has a bowel movement and it indicates stress, the baby's stressed. By itself, it can be used as an indication for a C-section. Does that mean we always do a C-section when we see meconium? Absolutely not. It's a puzzle, it's a whole puzzle, whole picture. We put it all together, all the information to make a decision, but it does raise the level a little bit. Chance that you're going to need a C-section might make us watch it a little bit more closely. You keep leaking until you have the baby. So once your bag of water is broke, you keep leaking until the baby comes, because your body and the baby and the placenta are still producing the fluid, but initially you have a lot of that fluid. Okay, now it's used with a cervix check, and we use something called a AROM hook, which is just a piece of plastic that has a little curve in it so that there's nothing sharp that touches the baby, and we put our fingers inside and we introduce the AROM hook and we just pull, and the bag of water, the amniotic sac, is thinner than a Ziploc bag, so it's very thin. So we often do that artificial rupture of membranes. There are some who say that they would like to avoid rupture of membranes because contractions can be stronger. What I say is, if you have an epidural, it won't make a difference. If you don't, and you're doing things naturally and everything's looking good, then it does generally make the contractions stronger. In fact, a half hour after you get your bag of water broke, that's when you'll feel how strong the contractions are. They usually don't get any worse, they just don't go away. But you are trading off perhaps a little less discomfort with the contractions, but a longer labor, versus maybe stronger contractions and a shorter labor. What is the right answer? I can't give you that specific. What I can tell you is that, generally speaking, most patients end up getting artificial rupture of membranes or rupturing on their own, but there are exceptions, and if your baby's doing well and everything's going fine and you would prefer to avoid that, then that is fine. Although if you have an epidural, I encourage you not to avoid it, because then the epidural could potentially slow down. If you avoid some interventions and get some, then some of them can slow you down, some of them can speed you up. There's a balance, and generally, if you've got an epidural, we do recommend rupturing the membranes when things are going well, and adding some Pitocin if your contractions slow down, okay? Because the fluid that you get with an epidural to help maintain your blood pressure can also slow down your contractions. A little bit of complexity there. What I'm just trying to explain is that each intervention has its pluses and minuses. Talk to your provider, go over it, and they'll be happy to explain what are the pluses and minuses, what are the benefits, and how we can best serve you to give you a great experience and low chance of a C-section and a great healthy outcome for you. I hope you found this information of use. Please leave your comments. Thank you.